In part 2 of endocrine system, I have discussed about this pancreas, adrenal gland, testes, ovaries, and also some other endocrine organs. So I hope you will enjoy the session, and if you have any doubts, please feel free to write to me. Let's start with the session now. Continuation of part 2 of endocrine system. We are going to start with the pancreas. The pancreas is a gland that is located in the retroperitoneal space. So the pancreas has a rich vascular supply, and it is having a thick connective tissue in the outermost layer. So pancreas in general, we call it as a mixed gland or heterocrine gland. That means it is functioning as both endocrine as well as exocrine gland. So let us see the location of the pancreas now. So if you look at the pancreas, it is acting as a digestive system organ as well as the endocrine system organ. So if you look at the posterior aspect of the body, this is a vertebral column. This is the first lumbar vertebra and second lumbar vertebra. So in this area, before the vertebra, you have a retroperitoneal space where the pancreas is located. So let us see the parts of the pancreas gland. For that, I need to remove the stomach and the peritoneum. Then only the pancreas will be visible as it is in the posterior aspect of the intestines, which is the retroperitoneal space. So if you see here in this place, the pancreas is a leaf-like organ. It is like a leaf-like organ. And you can see here, this pancreas is having the head, body, and the tail. This is the head. This is the head. I turned the pancreas. So let me show you the landmark of these areas. So if you see here, this part is called as the head. This is the head. And this part is the body, and this is the tail end of the pancreas. This is the tail end of the pancreas. This small projection here is called as the uncinate process. This small projection is called as the uncinate process. If you see, the whole head of the pancreas is hugged by the C-shaped duodenum. This is the C-shaped duodenum. The whole head is hugged by the C-shaped duodenum. The whole head of the pancreas is hugged by the C-shaped duodenum. And if you see, this is the anterior view. This is the opening of the pancreatic duct. This duct is present in the inner aspect of the pancreas. So what I will do, this is the duct. You can see this is the pancreatic duct that is extending in the head, body, and the tail. If you see here, this opening is called as the superior duodenal papillae. And this is the inferior duodenal papillae. The opening is called as ample of Vater. There is a round muscle here around this opening, that's called as the sphincter of ODI. Actually, in the intrauterine life, this is a separate opening for the liver, and this is a separate opening for the pancreas. So what happens, this duct will fuse and join with the pancreatic duct. Okay, for that you need to, I will remove a little bit of the pancreas here. Okay, you see this is a bile duct. In fact, this opens as a separate duct in the intrauterine life during the embryonic formation, and this opens as a bile duct. Okay, so what happens, this will become redundant, this will become fuse, and the bile duct and the pancreatic duct joins here. So we will see this anatomy further, okay. So now what you can see here is the pancreatic gland. So yes, now what I will do is, let us discuss a few words about the vascular supply. Pancreas, which is in the retroperitoneal space, is a highly vascularized organ. Okay, so now if you look at the splenic artery, you can see the spleen is present in the tail end of the pancreas like this. This is the spleen. The spleen is present in the tail end of the pancreas. Okay, so the splenic artery is running on the superior border of the pancreas. Okay, this is the splenic artery. I'm going to show you. Yes, this is the splenic artery. It is running on the superior border of the pancreas. And while it is a branch from the celiac artery, in fact, that we will see in the circulatory system. So this artery is giving many perforating branches for the pancreas, and it is supplying blood for the pancreas also. Then the head part is supplied by the superior pancreatic artery, pancreatico-duodenal artery. This is the posterior pancreatico-duodenal artery that is supplying the head region, of the pancreas. Okay, so, and if you look at the splenic vein that is running in the posterior border of the pancreas, that is running on the posterior border. So this is the splenic vein, and that is running in the posterior border of the pancreas. The splenic artery is running on the superior border of the pancreas. So this is how the pancreas is getting good rich vascular supply. Okay, so this is what you have to know about. In fact, the pancreas, when there is any pathology like pancreatitis, so what happens, it leads to increased collection of fluid around the pancreas. That is not around the pancreas, inside the pancreas, as the connective tissue of the pancreas. The outermost layer of the pancreas is very strong and thick. The outermost connective tissue layer of the pancreas is very strong and thick in nature, and it doesn't rupture soon. So, and that can also lead to severe compression of the pancreatic tissues and leading to necrotizing pancreatitis. Okay, so this is some little bit of anatomy you have to know about the pancreas gland. Coming to the histological aspect, around 85% of the pancreas cells are made up of pancreatic acinar cells, which secretes pancreatic amylase. Okay, that comes to the pancreatic duct and drain into the duodenum. Whereas 15% of the cells are endocrine cells. These cells are scattered all over the pancreas. Okay, these cells are scattered all over the pancreas, but in the body of the pancreas alone, there is more concentration of these endocrine cells. In the body of pancreas alone, there is more concentration of these endocrine cells. That is what we call it as islets of Langerhans. Okay, so the islets of Langerhans is nothing but the endocrine cells. The islets of Langerhans is nothing but endocrine cells. There are three types of cells. One is alpha cell, beta cell, and the delta cell. Okay, so these are the alpha cells that produce glucagon, and beta cells that produce insulin, and delta cell that is producing somatostatin. So here the very important hormone is the beta cell that produces insulin, which reduces the blood sugar level. Okay, then the alpha cell that is producing the glucagon will increase the blood glucose level. So there is a homeostasis function, okay, between this insulin and glucagon, which is reducing and increasing the blood glucose level. So you can see here, this is a pancreatic acinar cells. This is a histology slide. This is a pancreatic acinar cells, and here you can see these endocrine cells are scattered here. They are the alpha cells which secretes glucagon, beta cells which secretes the insulin, and the remaining cells are the pancreatic acinar cells. Okay, so if you see, when the blood glucose level increases in the blood, what happens? Immediately pancreas will sense it and releases insulin. So what is the role of insulin? Insulin is acting as a catalyst to convert glucose into ATP. That's the energy, calories. Okay, so what happens? This increased insulin will go to the cells and allow the glucose inside the cell, and it is helping in the TCA cycle. Okay, so there are 50% of the glucose that is converted into glycogen and stored in the liver for future use. So half of the glucose is converted into energy by the cells in the body, and half of the glucose is converted into glycogen and stored in the liver for future use. Thereby the sugar level in the blood, that is the glucose level in the blood, will come to normal, about 90 to 100 milligram per dilution. That is the normal blood sugar level. That's a normal blood sugar level. So we will speak about blood sugar now. Next, suppose if the person doesn't eat anything, like any juice or anything, if he doesn't drink, so what happens? The blood sugar level will reduce in the blood. Okay, so blood glucose level will reduce in the blood. That is called as hypoglycemia. Increased blood sugar level in the blood is called as hyperglycemia. Decreased blood sugar level is called as hypoglycemia, which is life threatening. So what happens? So that time the pancreas will sense it, and then it releases the insulin will be stopped, and insulin secretion will be stopped. So when the blood sugar level is low, the pancreas will sense it and release the glucagon. So this glucagon will go to the liver and convert the glycogen into glucose, and again send it back to the bloodstream. So thereby the normal blood sugar level is maintained. This is the balance between this. So what happens? These are the terms that you need to understand in biochemistry. So what happens? Conversion of glucose to glycogen by insulin is called as glyconeogenesis. Okay, then conversion of this glycogen into glucose by the glucagon is called as glycogenolysis. Okay, so glucose will be converted into acetyl coenzyme, then acetyl coenzyme will be converted into ATP. So in that process, conversion of glucose to acetyl coenzyme is called as glycolysis. Then conversion of acetyl coenzyme back into glucose is called as glyconeogenesis. So these are all the terms you have to understand. Understand glycogenolysis and glyconeogenesis. Okay, conversion of glycogen back to glucose is called as glycogenolysis, and conversion of glucose to glycogen and stored in the liver is called as glyconeogenesis. Okay, so now we will see what is about insulin. Okay, insulin is a big industry because most of the population, I mean, a lot of patients are there with suffering with the diabetes, that is increased blood sugar level. It can be of issue with the insulin or receptors, insulin receptors in the cell, anything. So we will see that now. Now, insulin is a type of amino acid. Insulin is a type of amino acid. You have to know that all the insulins are injected in the subcutaneous layer, because and after you inject the insulin, you should not rub. Why? Because the insulin that you inject into the body is made up of a protein, the amino acid, which has to be absorbed at a slower rate. That is why we inject the insulin in the subcutaneous layer of the body. We inject the insulin into the subcutaneous layer of the body. So now, insulin, the role of insulin is to decrease the blood sugar level. How? By three ways. One is the increasing the membrane transport of glucose. For example, in the blood, in the extracellular fluid, the blood glucose is roaming. The membrane permeability is increased so that the glucose directly goes into the cell. Okay, thereby the glucose will be utilized and glucose will be reduced. Then it inhibits the breakdown of glycogen into glucose, okay, in the liver. Then it inhibits the conversion of amino acid or fats to glucose. See, in fact, you eat carbohydrate, you eat fats, and you eat proteins. Okay, when first all the carbohydrates will be converted into glucose. Once the carbohydrates is finished, then the fats will start to break and be converted into glucose. Once the fat is less, then amino acid, the proteins in the body will start to melt and be converted into glucose. This is the normal energy flow process in the body. This is a normal energy flow process in the body. So in this scenario, the insulin is playing a major role in these type of conversions. Okay, next, what are the factors that responsible for release of insulin in the blood? One is the elevated blood glucose level. Once the pancreas sends high blood sugar level, the insulin will be released. Okay, then rising blood sugar or blood level of amino acid and fatty acid can also increase the insulin release. Acetylcoenzyme released by parasympathetic nerve fibers can increase the release of insulin. Hyperglycemic hormones, for example, glucagon, epinephrine, then growth hormone, thyroxine or glucocorticoids, these hormones, they increase the blood glucose level, so then also the insulin is released. Okay, so these are all various factors, okay, that makes the insulin to be released by the pancreas into the bloodstream. Then other factors that influence insulin release are results from wider hyposecretion or hypoactivity of insulin. Okay, if insulin is absent, suppose in case if the pancreas is unable to release the insulin into the bloodstream, okay, or if the insulin secretion is not present in the pancreas, then the blood glucose level will increase. Those conditions we call it as insulin dependent diabetes. That is, a patient has to inject artificial insulin directly into the body. Okay, then in case if the sufficient amount of insulin is present, but the insulin receptors of the cell membrane is non-functional, so then also the blood glucose will increase. So that means what? This type of diabetes is called as non-insulin dependent diabetes. So these patients no need to inject insulin, but they have to take oral medications to activate these kind of insulin receptors of the cell. Okay, this is what we call it as non-insulin dependent diabetes mellitus. Okay, so in case if the blood sugar level increases, what happens? There is increased urine output, polyuria, because the renal nephron membrane permeability will increase and it will not absorb the water back. Okay, then polydipsia, because of loss of more water in the urine, then the patient will have to take more drink more water. Okay, then polyphagia. These are all the signs of diabetes mellitus, and the patient gets confused and all this. So in fact, hypoglycemia is more dangerous than hyperglycemia. Hyperglycemia means increased blood sugar level, then hypoglycemia means decreased blood sugar level. Okay, now let us see the symptoms that is related with diabetes mellitus. Look at the symptoms of diabetes mellitus due to insulin deficiency, that is lack of insulin, or due to non-functional situation of insulin receptors on the cell. Okay, both these things can increase the blood sugar level. Okay, what is the normal blood sugar level? It is around 90 to 140 milligram per dl. This is the normal blood sugar level. Suppose when the person eats food, then blood sugar level can go between 130 to 140, 150, like this. Okay, suppose the person is not eating food, or any glucose level, having any glucose intake like juice or anything like that, then the blood sugar level will go between 80 to 100. Okay, so below 80 we term this condition as hypoglycemia. Above 150 we term this condition as hyperglycemia, that is increased blood sugar level, hyperglycemia. Now imagine if the pancreas is not secreting insulin, or the insulin receptors on the body cells is not working, then what happens? The blood sugar level will start to increase. Okay, we call it as hyperglycemia. This is what we call it as hyperglycemia, when there is decreased insulin utilization or glycogenolysis, conversion of glycogen into glucose, then protein catabolism and gluconeogenesis, lipolysis or ketogenesis. All these are the situations which can increase the blood sugar level. So when there is increased blood sugar level, then the sugar tries to escape through the urine. Okay, so presence of more sugar in the urine, we call it as glycosuria. Okay, that increases the osmosis and increases the urine output. That is what we call it as osmotic diuresis. So patients who suffer from diabetes, before diagnosing them that they are diabetic, in the night time, if they see, they go to bathroom to micturate around 3 to 4 times in the night, and they start to drink more water. Okay, so even since there is more glucose in this urine, you can see there are high chances of infection in the urinary tract because of presence of more glucose in the urine. Okay, so this keeps running. Okay, that's what we call it as polyuria and dehydrations. Okay, polydipsia means it is increased tiredness and weight loss, and polyphagia. Okay, so these are the symptoms when the patient has high blood sugar level. Okay, so what happens? This blood sugar level can be, increase in blood sugar level can be due to breakdown of fats and protein also. That's what we call it as lipolysis, that is breakdown of fat, conversion of fat into glucose, okay, and ketogenesis. So even this is, the proteins are converted into glucose. So that time what happens, the cholesterol level in the blood will increase, and also the ketone level in the blood will increase. Ketone is an acidic substance, okay, it's a protein metabolism output. Ketone is an acidic substance, so that leads to ketoacidosis, okay. So what happens, the kidney, when they filtering the urine, even the ketone body starts to escape through the urine, okay. Along with that, there will be sodium and potassium loss also. So this is called as ketonuria, that is release of ketone bodies in the urine. So this situation takes place when the blood sugar level is more than 300-350, okay. So what happens, this is a very chronic situation, this is a very advanced situation, diabetes. So you have to control the blood sugar level in this time itself, when there is polyuria, polydipsia, polyphagia. If you ignore that, then even the fats and protein starts to break and start to release the ketone bodies, which is a toxic substance. So what happens, these ketones give a type of flower smell, which called as acetone. It's a ketone smell. The smell of the urine will be like some sort of a flower, okay. So even when the patient breathes, the breath will be like a acetone smell. Then hyperpnea, that is increased in breathing level. The patient feels vomiting, nausea, abdominal pain. Then there will be disturbed heart beat due to loss of potassium and sodium. Then central nervous system depression, and finally the patient leads to coma. So this is called as metabolic infarct, that leads to metabolic infarct. That is, in the brain there will be multi-level patch damage, okay. The damage will be in different parts of different areas of the brain in small patches, okay. That is the situation that happens in the the patients loses the mental status. They start to have irrelevant speech, changes in mental status. They become violent, sometimes they get depressed, and finally gradually they still sleep and they go into coma stage, okay. So this is a complication of high blood sugar level, okay. We may get some patients with 400-450 blood sugar level. This is very dangerous. They will be marching towards the coma stage, okay. So this is what you have to know a little bit about the diabetes mellitus, okay. Now this is just a case study. A woman is brought into the emergency room. She is hypotensive, that is decreased blood pressure level and breathing fast, okay. Her breath is smelling like ketones. So naturally there is increased blood sugar hypoglycemia, increased potassium hyperkalemia, and blood gas level are where blood gases values are consistent with metabolic acidosis. So that means the patient is having hyperglycemia due to insulin deficiency, hypotension due to loss of blood volume because the kidney keeps releasing the urine more and more, okay. Then there is more production of ketone bodies that leads to ketoacidosis, metabolic ketoacidosis, okay. Hyperkalemia is increase in potassium level, which promotes due to lack of insulin, okay. That also potassium is the main substance during muscle contraction. So when the potassium level is increased or decreased, then it disturbs the heart muscle contraction also, okay. Now if you see here, when the blood sugar level is 30 to 70, it is hypoglycemia. Between 70 to 100, it is normal blood sugar level. different book give different type of values, but know that around 90 to 120 or 130 the blood sugar level is accepted. Okay, then if from 120 to 140 we call it as pre-diabetic range, and above 140 we call it as diabetic range. Okay, so this hemoglobin A1C is the value that is tested to show the 3-month glucose status. For example, it should be around 4 to 7 value, but if it is more than 7, that is showing that the patient is having uncontrolled diabetes. Okay, so there is to diagnose the patient as diabetes, we have to do glucose tolerance test. Okay, where we give glucose to drink, and we check the blood sugar level every 30 minutes and form a graph to show that how at what rate the glucose is being reduced by the insulin. Okay, so this is what you have to know about the diabetes, the pancreas gland. Let's go with the adrenal gland. Okay, the adrenal gland is also called a suprarenal gland, which is sitting like a crown on the kidney, kidneys. Okay, so you can see the adrenal gland. It is present at the level of the 12th thoracic vertebra. The adrenal gland is having adrenal cortex and the adrenal medulla. Okay, so both this adrenal gland is controlled by the nervous system. Okay, so adrenal medulla is present in the center, and adrenal cortex, which is producing adrenaline and noradrenaline. Okay, it's also called as epinephrine or norepinephrine. Both are the same name, adrenaline or epinephrine, noradrenaline or norepinephrine. Okay, so this is called as hormone of triple F, that is fight, flight and fright. So that means what? Whenever there is 3 situations like flight, fright and fight, this hormone is released and it produces enormous amount of glucose, and the enormous amount of glucose is converted into ATP to give energy. Okay, so coming to the adrenal cortex. Okay, so this adrenal cortex, it secretes cortisol. It secretes the cortisol hormones. Okay, so what happens? We have 3 layers of adrenal cortex. One is the first layer is zona glomerulosa. Next layer is zona fasciculata, and third layer is zona reticularis. We will see the respective secretions. Okay, coming to the blood supply, the adrenal gland is receiving the blood from the superior suprarenal artery, then middle suprarenal artery and the inferior suprarenal artery. Okay, so these are all the vascular supply for the gland. So now what we will do, we will see the different zones and their secretions. Okay, you can see here the adrenal gland is having adrenal cortex and the medulla. As I told you, medulla is secreting epinephrine and norepinephrine, whereas adrenal cortex is secreting glucocorticoids, mineralocorticoids and the sex steroid hormones. Okay, so we will see these hormones. First of all, you can see, as I told you, there are 3 layers of adrenal cortex. This is the adrenal cortex. The outermost layer is the capsule, which is a connective tissue that is covering the whole gland. Below that, you have the outermost layer, zona glomerulosa, that secretes the sex steroids, that is the aldosterone. It's a testosterone hormone. It is secreted in both female as well as males. Okay, then the next layers of cells are called as the zona fasciculata. Okay, these are the layers of the cell which is called as zona fasciculata, which secretes the adrenalocorticoids and the mineralocorticoids. okay, mineralocorticoids and the glucocorticoids. Okay, next layer is the zona reticularis. Okay, the zona fasciculata and the zona reticularis, they secretes glucocorticoids and the mineralocorticoids. So in general, you can see in the adrenal cortex is secreting glucocorticoids, mineralocorticoids and the sex steroids. The glucocorticoids are also called as cortisol hormones. Then mineralocorticoids are also called aldosterone hormones, and the sex steroid hormones also called as the testosterone hormone. So now we will see the different hormones. Okay, you can see these are three layers: glomerulosa, fasciculata and the reticularis in the adrenal cortex. Okay, the adrenal medulla is secreting epinephrine and norepinephrine. Okay, now coming to the mineralocorticoids, that is aldosterone. What is the response? What is the function of this aldosterone? One is it increases the potassium level, increases the renin, and decreases blood flow to the kidneys. Okay, so these are the important functions. So regulates the body's concentration of electrolytes, like example sodium and the potassium, by acting on the kidneys. Okay, you know what, in the kidney during the time of urine formation there are three stages. Okay, filtration, simple filtration, then selective reabsorption and excretion. In the selective reabsorption, whatever electrolytes that is needed, it is being reabsorbed by the support of this aldosterone. Okay, so thereby it increases the sodium reabsorption, potassium excretion, and increases water reabsorption through osmosis. Next, you can see major mechanism controlling aldosterone release from the adrenal cortex. So one is renin-angiotensin aldosterone mechanism. So this mechanism you will study in the renal system, in the urinary system. Then plasma concentration of potassium, that is the level of potassium that is present in the blood plasma, that also makes the release of this aldosterone. Then adrenalocorticotropic hormone that is released in the pituitary gland also makes the adrenal cortex to produce the aldosterone. Okay, then atrial natriuretic peptide, this level also will increase the. So at the end of the day, what happens, these are all the four methods which makes the adrenal gland to secretes this aldosterone, that is acting on the kidney, which is helpful for maintaining the sodium potassium level and the blood volume. Glucocorticoids that is secreted in the adrenal cortex will help maintain blood glucose level and blood pressure. It includes cortisol, cortisones, and acute stress disturbs the normal cortisol rhythm. Okay, then higher CNS interrupts the feedback system and increases the corticotropin releasing hormone. Okay, next, what is the action of glucocorticoids? One is the gluconeogenesis, then breakdown of proteins for repair and to synthesize enzymes, then enhance sympathetic nervous system, that is causing vasoconstrictive effect, so thereby it maintains the blood pressure level. Okay, the main thing is has anti-inflammatory and anti-immune effect. Okay, you know, whenever there is any inflammatory reaction in the body, this hormone is released and that inflammatory process is reduced. For example, when whether some patients they suffer from severe allergic reactions or some sort of inflammatory process that is going on, then they give some anabolic steroids, that is like a glucocorticoid steroidal drug like type. Okay, so these steroidal drugs has effect to reduce the inflammation. So that is what is we use the drugs like betamethasone, dexamethasone, hydrocortisone, then different types of, these are all the steroidal drugs that reduces the inflammation which we give during the time of asthma or during the time of immune reactions in the body. Okay. Then the other function of glucocorticoids are depresses cartilage and bone formations, disrupts normal CVS, neural and GI functions, controls symptoms of chronic inflammatory conditions. Okay, next, coming to the pathophysiology of adrenal gland. Okay, if there is a disorder of corticosteroid, that is adrenal cortex dysfunction, it leads to, one is Cushing's syndrome, which is excessive production of glucocorticoids. Okay, so when the adrenal-corticotrophic hormone in the pituitary gland is released too much, that comes and stimulates the adrenal gland in the adrenal gland above the kidney and make them to secrete more glucocorticoid hormones, so which leads to steroid-induced diabetes mellitus, then Cushingoid sign and severe overwhelming infections. So this is the Cushing's appearance. If there is a Cushing syndrome, there is emotional disturbance, then the cellular tertica may be enlarged, that is the pituitary fossa where the pituitary gland is present may be enlarged, and the face will be round and moon-like appearance, moon faces. Then osteoporosis, the weakening of the bones will be present. Then cardiac hypertrophy, increased tone of the heart muscle, that is leading to hypertension. Then the back bends, we call it as buffalo hump. Then obesity is present. Then there can be hyperplasia, that is increased function of the adrenal cortex cells. Then thin wrinkled skins, striations in the abdomen, absence of menstrual cycle, muscle weakness, purpura and skin ulcers. These are all the features of Cushing's syndrome in the adult. Okay, you can see this is the normal patients, and when the adrenal cortex starts to function more, she changes like this, and this is a buffalo hump. This is the humping of the thoracic spine. Okay, we call it as buffalo spine. These are all the characteristic features of the Cushing's syndrome. Okay, next, there is another condition called Addison's disease, that is decreased secretion of glucocorticoids and mineralocorticoids. So what happens here? So when there is increased ACTH or atrophied adrenal gland, and that leads to decrease in the secretion of these adrenal cortex hormones, it leads to weight loss, low blood glucose level, low sodium level, increased potassium level, common severe dehydration and hypotension. Okay, so in Addison's disease, there are bronze pigmentation of the skin, changes in reception of body hairs, gastric disturbance, then postural hypotension is present, decreased blood glucose level is present, weakness is present. Okay, prolonged tiredness will be present, then vascular decrease in BP, then kidney doesn't function properly, the potassium will be decreased and potassium will be increased and sodium will be decreased. So these are all the effects of decrease in the adrenal cortex level. So by replacing the oral glucocorticoid and mineralocorticoids, this can be controlled, this progression can be controlled. So that's what we call it as Addison's disease. So the opposite of Addison's disease is the Cushing's disease, Cushing's syndrome. So Cushing's syndrome is a hypersecretion, and Addison's disease is a hyposecretion of adrenal cortex. Okay, then the 6 hormones, that's the testosterone, androstenedione or dihydroepiandrosterone. This is the hormone that is present both in male as well as females. Okay, so in fact the testosterone is present in the female also due to secretion by the adrenal cortex, Okay, it causes axillary and pubic hair growth in both sex drive in adult females. Then does not exert feedback inhibition on ACTH release. Okay, so coming here, let's go to the adrenal medulla. This adrenal medulla, there are chromaffin cells, okay, which is having which is a type of sympathetic neurons. Okay, so unequal amounts of hormones are stored and released. 80% of the epinephrine and 20% of norepinephrine is produced, okay, by this adrenal medulla, which is a stress hormone. So I mean, when it is a stressful situation, this kind of hormones are released. Okay, so when epinephrine is released, it increases the metabolic activity and bronchial dilatation takes place. Okay, but now at the same time, norepinephrine will increase the peripheral vasoconstrictions and increase the blood pressure. So what happens when the blood is low? When the blood is low, for example, when even the emergency situation, if the patient is having severe amount of blood loss, they inject adrenaline, thereby the peripheral vascular vasoconstriction is present and all the blood is pushed towards the heart. So thereby the patient can be stable. So there are a lot of pharmacological use with this adrenaline and noradrenaline. Okay, so as I told you, the nervous system, the spinal neurons from the spinal nerves will stimulate the adrenal cortex and adrenal medulla and make them to release this stress hormone epinephrine and the norepinephrine. Okay, next we have to look about the gonads. To the testes, the gonads, which is also acting like a heterocrine gland. So the endocrine function is production of testosterone hormone, whereas the exocrine function is production of sperm cells. Exocrine function is production of sperm cells. So that's why the testis is called as the heterocrine gland. It is functioning as both endocrine as well as exocrine gland. Okay, so coming to the endocrine part of this testosterone testes, there are interstitial cells, okay, that produces this testosterone hormone in the testes. Okay, whereas the seminiferous tubules that is present in the testes will produce sperm cells, that is exocrine part function, and the interstitial cells, that is also called as the Leydig cells, that is producing the testosterone. So this testosterone is a male sex hormone. Okay, it helps to develop male and then maintain the sexual trait in male. Okay, so during puberty, testosterone helps to bring about the physical changes that turns a boy into adult male. For example, like increase in bone density, then growth of facial hairs, axillary and pubic hairs, change of voice. All these are the growth changes, okay, that is done by the testosterone hormone. So once the testosterone hormone starts to release, there is growth of penis and the testes, there is growth of facial and pubic hairs, the voice gets deepened, and increase in muscle mass and strength and increase in height is taking place. Okay, throughout adult life, testosterone helps to maintain sex drive, sperm production, male hair pattern, increase in muscle mass and bone density. Okay, then decrease or absence in testosterone may cause decreased sexual drive, impotence, altered body image, and other symptoms like the person even reduced testosterone level also will lead to decreased symptom. I mean, chances of fertility is very less. Okay, so coming to the ovary is present in the pelvic cavity. The ovary is present in the pelvic cavity, and this ovary is a replacement of testes in male. Okay, this ovary is a replacement of testes in male. So The male has testes as a gonad and female has ovary as a gonad. So there are two right and left ovary. The most important hormone for a woman's twin reproductive gland, that is the ovaries, are the estrogen and the progesterone. So what happened? This estrogen and progesterone is very important to maintain the menstrual cycle as well as the pregnancy. Okay, these hormones are responsible for developing and maintaining female sexual triads as well as maintaining pregnancy. Okay, so female sexual triad means there is lot of things like changes in voice pattern, then accumulation of more subcutaneous fat. Okay, so then the psychological changes, all these are the female sexual triad. So along with the pituitary gonadotrophin, that is the follicle stimulating hormone, and the luteinizing hormone, they also control the menstrual cycle and the breast development. Ovaries are also produce inhibin, a protein that curbs the release of follicle stimulating hormone from the anterior pituitary and helps control egg development, that is the ovum, the outer layer of the ovary. Okay, the most common changes in the ovarian hormone is caused by the start of menopause, part of a normal aging process. Okay, menopause it happens at around 45 to 50 years of age in females. So this menopause will is due to the changes in the hormonal level. Okay, that is estrogen and progesterone. Okay, so this can happen if the ovaries are removed surgically. Then loss of ovarian function means loss of estrogen, and which can lead to hot flashes, thinning of the vaginal tissues, lack of menstrual period, mood changes, and bone loss and osteoporosis. These are all the changes that is taking place after the menopause. Okay, due to lack of estrogen. Okay, overproduction of male hormones in females affect menstrual cycle. Okay, male hormones in female, that is produced in the adrenal cortex, which can affect the menstrual cycle. It can lead to fertility disturbance, hormone level, as well as cause acne, facial hair growth, and male pattern. So the growth of facial hairs. Okay, so this is common in polycystic ovarian disease, where there is cyst formation around the ovary, and that leads to increased production of this male sex hormones in female. Okay, so apart from these glands, there are other organs that is also producing the hormones that acts like a endocrine gland. Okay, so we will look few about that. One is the stomach, that is secreting gastrin into the bloodstream. Okay, which consists of peptide, and it triggers the food and cause stomach to produce hydrochloric acid. Okay, which is helpful in the digestion process. Then stomach also secretes serotonin that acts on the stomach muscle and causes the stomach muscle contraction. Then duodenum secretes gastrin that reduces the hydrochloric acid secretions in the stomach. Then the duodenum secretes secretin that makes the pancreas to release the pancreatic juice. Okay, then the liver to secrete the bile, and the stomach to inhibit the pancreatic juice release. Okay, then the duodenum is also secreting the cholecystokinin. Okay, that makes the pancreas to release this pancreatic amylase. You see, the stomach and the duodenum, it is acting among themselves. You see, gastrin is making HCl to secrete, whereas duodenum, gastrin that is secreted in the duodenum reduces the HCl secretion in the stomach. Okay, so likewise, if you look at the kidneys, they are producing erythropoietin, which is very important hormone for production of RBC cells. These erythropoietin go to the bone marrow and activate the bone marrow to produce the red blood cells. Okay. Red blood cells live for 120 days and they die. So after that, these dead RBC cells are replaced by the bone marrow. Okay, for which erythropoietin is very essential. So patients who are suffering from renal failure, we need to inject erythropoietin hormone every month or bi-monthly, so that they don't suffer with anemia. Okay, then the skin is secreting cholecalciferol, where it is helping the intestine for calcium transport. Okay, which is then the heart is producing antinatriuretic peptide. Okay, which acts on the kidney to help in the sodium reabsorption and renin release. Okay, it also helps adrenal cortex to inhibit the aldosterone secretion. So you see, these are all various other endocrine hormones that is secreted by this duodenum, stomach, kidney, skin and the heart. Okay, so apart from this, the liver is producing insulin like growth factor, angiotensin and thrombopoietin, and adipose tissue that is producing the leptin, all this. Then corpus luteum in the ovary that is producing the progesterone and estrogen, and the placenta after the conception produces progesterone, estrogen, HCG, human chorionic gonadotrophin, and HPL, that is human placental lactogen. See, so thereby when the HCG is produced by the placenta, this kidney will start to filter the HCG in the urine. So after pregnancy, after 3 or 4 days, this HCG, after conception of the child, after 3 or 4 days, this HCG start to release in the urine. So detecting the HCG level in the urine will confirm the pregnancy. If the female is pregnant, and the HCG will be present in the urine. So by detecting the HCG, we are confirming that the female is pregnant. Okay, so that is the HCG released by the placenta, human chorionic gonadotrophin, that is very essential for the embryo to grow. Okay, so these are all some of the endocrine glands that you should know in order to understand about the endocrine function. By this, we are completing the endocrine system, and good luck for your understanding.